Hi everyone, I am Dr.RUkmani Choudhary and my today's topic is abnormal vaginal discharge and its homeopathic management. So we'll talk about everything like, is it normal having regular vaginal discharge and what type of vaginal discharges are there and in which type of vaginal discharge you can use what kind of medicine. Requested to watch complete video for complete information. If you're watching first time, please like, share, press the bell icon to get notified. Thank you so much. So let's begin. Vaginal discharge. See, vaginal discharge is a regular occurrence and it is completely normal, natural. And see, if you seen that a yeast infection, vaginal yeast infection video, so in that video I also discussed about vaginal pH and what is normal vaginal pH and why is it a normal phenomena of having normal vaginal bacteria and unhealthy vaginal bacteria and so on. So vaginal discharges are normal, they are normal. There is a natural defense mechanism of vagina. Obviously, in vagina is obviously the root of uterus, the female reproductive system, and for the protection of that female reproductive system, vaginal pH is maintained by some healthy bacteria. So at times it is disturbed and there is a disbalance. In that case, you have started infection, and so your discharge varies with the infection. If it is normal, non-infectious, then there are different types, and if it is infected, you are having certain acids, then our main purpose differentiating among all the vaginal discharge and using medicine accordingly, that what type of infection you are having, what type of vaginal discharge you are having. White vaginal discharge. So if you are having normal white vaginal discharge on a regular basis, then it is completely normal, nothing to worry about until or unless you are having cottage like appearance or having cheesy appearance, means it is like curd like appearance. So once it is curd like, then this is a cause of concern and this can be a sign of yeast fungal infection. Video already uploaded, you can check that video. So in case this is a cause of concern. Clear and watery discharge. Clear and watery vaginal discharge, again perfectly normal, nothing to worry about. This usually happens after your exercise, once you do intense exercises. So in that case you have clear and watery discharge, and that is absolutely okay. Clear but stretchy, you are having clear vaginal discharge, but this is stretchy one, and this happen usually during your ovulation time. This is mucus one. So this is again completely normal. Brown and bloody discharge, so this is a cause of concern, you are having brownish bloody discharge. So this is a cause of concern. See, if it is occurring end of your periods, then there is no worry. But if it is occurring regularly and mid time of your periods, mid month, so this is a cause of concern. In that case, you can go for pap smear test and yearly examination, your pelvic examination, if you are having this on a regular basis and there are other symptoms you are having pelvic pain, abdominal pain. So in that case only, this can be rare to rarest. This can be due to cervical cancer, this can be fibroids. So yes, if you are having on a regular basis, and then pap smear test and your pelvic examination yearly basis. Yellowish or greenish discharge. See, yellowish or greenish discharge when you have trichomoniasis, again a kind of sexual infection, and I have already uploaded video by the name of difference between STI, sexually transmitted infection, and sexually transmitted disease. Certain disease are, you catch them by sexual route, so you have to maintain certain precaution, and these all things already in that video, in that STI and STDs. You can catch this infection and you have greenish and yellowish discharge in trichomoniasis. So this is again sign of infection and treated accordingly. So it is a very important fact that we should know about the type of discharge and your treatment, obviously based on all these underlying symptoms. Now the causes why you have this vagina and when it is normal, when it is abnormal. See, in the healthy condition, normal condition, you have it after doing intense exercise, you have during your ovulation time, and you have when there is a sexual arousal. So these are certain normal condition when you have normal vaginal discharge. On the other, you have infection when there is a any kind of infection. You have when you have bacterial vaginitis, when you have human papilloma viral infection, when you have PID, pelvic inflammatory disease, in gonorrhea infection, sort of infection in which you have offensive, or like you have itching in that discharge, you have offensiveness, there is a associated symptom like pelvic, lower abdomen, pelvic pain, urinary symptom as well. You need to go for an examination or when there is a medical attention required. When you have abnormal discharge on a regular occurrence, when you have lower abdominal persistent pain, when you have fever, when you have frequent urine infection, so these are certain like signs in which you see medical attention your doctor right away. So now home care, how you can manage it at home easily by following some healthy precaution or healthy steps. So number one obviously comes your hygiene. Hygiene is the most important factor that you have to maintain hygiene. You have to maintain that cleanliness for that part, but don't be so harsh that don't use the strong odorous any wash because they can irritate that the skin part. There are cotton undergarments obviously for soothing for that area, and just have plenty of water so there are less chances of having urine infection. Urinate frequently so that there is no any chances of any infection. So just frequently and having safe protection, so you don't have any like a risk for having STDs or STIs. So use protection for that part and know the symptoms, so get treated as soon as possible. Homeopathic treatment, best effective homeopathy medicine for several medicine according to a patient's history, according to patient's age, patient's constitution, even patient's mental symptoms matter a lot in homeopathy. And these are not the limited medicine that these are the only medicine you have to use. Medicine can differ according to patient's history, so it is not possible to discuss about every medicine. So I'm having some limited or some general medicine for leucorrhea. Sepia is a very good medicine in cases of leucorrhea, means white discharge. In sepia you have itches a lot, and in that you have around your menopausal time. So sepia use around your menopausal time, and when you are like indifferent, socially isolation, and you are very weak, lethargy. So in this case you can use sepia and medicines link if you're watching on YouTube, given in description box below. But buy medicine according to your case. Don't buy all the medicine not required. Understand this fact. And the company, the color can differ, just and even quantity. Use always smaller quantity, less quantity. Start with the lower doses, and this medicine name should be authentic. Just have 1 or 2 drops directly on tongue before meal or after meal, like 30-minute gap should be there. Pulsatilla. Pulsatilla again a very good medicine. Pulsatilla is given when you have discharges during your puberty, means you are having your periods, there is a starting of your menses and you are having irregular white discharges, and there is a greenish and yellowish discharge. So in that case you can use pulsatilla. Same way, these are oral medicine. You have to use orally 1 or 2 drops twice or thrice before having meal, minimum 6 weeks, almost 30 days. And calcarea phos. Calcarea phos again used during your puberty time, and it is associated with headache, means you are having headache, and so you are having like leucorrhea, white discharge. So in that case you can use calcarea phos. Calcarea carb is when you are obese, you are fatty, flabby and fair constitution. So calcarea carb is given, and calcarea carb is always like feels better when constipated and craving for undigestible things like chalk, pencil, even eggshell. So in that case you can use calcarea carb. Have milky white discharge, so it depends at what type of discharge even you have. Abnormal craving for salt you have, and there is again thick water. Lumina is again very good medicine in homeopathy. Profuse vaginal discharge, even sometime female complain that they have so much of discharge they have to change your underwear. This is very good medicine in those cases when you have profuse, there is an excessive vaginal discharge and it runs through your heel. So in that case use alumina, very good, but the discharge is transparent, it burns a lot. So in that case creosote again a very good medicine in white abnormal vaginal discharge or leucorrhea. Creosote is given when you have corrosive acrid discharges, means you are very irritated of that discharge, that there is a intense itching, corrosiveness is there, offensiveness is there. Medicine biocombination 13, biocombination leucorrhea. So you can use this medicine. This is given when you have inflammation in your vagina, there is a swelling. So in that case you can use this medicine. This is in the drop form, so just add some like 5 or 10 drops of medicine in some water, lukewarm water, and just have it like before having your meal. This video can give you some amount of knowledge. If you find this video knowledgeable, informative, please like, share and subscribe my channel. Press the bell icon to get notified. Keep watching, keep supporting. Thank you so much. Thank you for your time. Thank you.